Hello everyone, my name is Dr. Manish Gupta. I am a senior consultant neurology in JP Hospital. As you know, today is 21st September and world acknowledges today as a World's Alzheimer's Day. This day is celebrated for the awareness of the disease, their common symptoms as well as the risk factors. As you know that Alzheimer's disease is a very debilitating disease and it's a progressing disease. Normally in a terms, if we say what are the symptoms, then the first symptom that starts is the memory complaints. Patient used to forget things, mainly the immediate one, and later on as the disease progresses, the patient will having difficulty in like jumbling of words, unable to process the thought, to process the sentence. Then patient may have difficulty in naming the near ones, their familiar faces, and later on patient can have wandering behavior. They can have a visual spatial disorientation in the form like they have a disorientation to the place as well as the person. Along with these symptoms, like Alzheimer's disease have three stages. Like first is the mild one, in which normally patient can work almost all the all the daily activities without any assistance, but patient had difficulty in processing the thoughts. But in and later stage, which we called as a middle stage, patient started having difficulty in like doing the routine activities, mainly the tasks. Patient start feeling frustration, and because of that patient can have behavioral changes in the form of anxiety, stress. Patient can be agitated because of that, because he is not able to complete the task, and at that time patient's relatives or the caregivers need the assistance. Along with this, as the disease progresses, that is in the late stage, this is the most serious stage, in which almost the patient is we can say unable to eat, unable to swallow. He forgets when to eat or not. There's a loss of appetite. They always confined to one bed. Patient can have bowel and bladder incontinence, and for everything, for every task, patient need a full assistance. So at this stage, normally the patient needs almost 24 hours care. As we know that when the patient or the attender came to know that the patient is having dementia or the Alzheimer's disease, they are quite reluctant to accept the disease, and it is very difficult for them to accept and to know the process of the disease as such for the Alzheimer's disease. And because of that, they don't seek for the diagnosis until it's very late. So that's why this year on 2021 on World's Alzheimer's Day, the theme of the campaign is that to know knowing dementia and knowing Alzheimer's disease. And so I request all of you to read it, to know about the common symptoms. There is a lot of the knowledge, or you educate yourself and to the nearby, so that we can identify the Alzheimer's disease on the early stage. Because if we find out, if we can diagnose it in an early stage, then yes, we know that there is no cure for the disease, but at least we can manage it accordingly for the patient, make the life of the patients better.